This is not a new drug or a new treatment. It's an old treatment or an old drug but being used for a new indication.
All over the world, researchers and healthcare professionals are scrambling for a way to slow down the novel coronavirus. On 20th April, a critical COVID-19 patient in Delhi's Max Hospital requested to be put on the experimental plasma treatment therapy and showed promising results. He was shortly weaned off ventilator support. A few days later, on April 26th, he had recovered completely and the 49-year-old patient was discharged. However, on April 29th, in Mumbai's Leelavati Hospital, a 53-year-old COVID-19 patient, the first in the state to undergo the experimental plasma treatment, passed away. Just a day before, on 20th April, the Union Health Ministry said that plasma treatment was not a proven therapy or treatment option for COVID-19. So what exactly is plasma therapy? And is there hope to be found in it?
So plasma therapy is nothing new to medical science. It has been used in past in certain other outbreaks, infective outbreaks, especially viral outbreaks like SARS. There's a process called passive immunity, where actually when a person is critically ill with a viral infection, we can actually inject into this patient's body preformed antibodies. Now, how do we get preformed antibodies? Imagine a situation where there's a person who has had COVID infection in past and has successfully recovered from it. Now, this person has recovered by virtue of his body having produced antibodies, the protective antibodies. So that means to say a person who suffered from COVID infection, he's declared negative, he's declared treated when his 2 consecutive tests come negative, the PCR tests. So then that means 2 weeks from then is the time when this person can become a voluntary donor and we can take out his plasma and it should have adequate amount of protective antibodies. Once we remove this plasma from this patient or healthy donor now and give it to a patient who's critically suffering from COVID, the presumption is that the antibodies in this plasma will immediately help kill the virus in the patient's body and he or she may recover. So the procedure is very simple. We basically connect the donor to a separator. The plasma is taken out. We take about 400 ml of plasma from one donor. It's very early days to really say the ultimate outcome, and there are many factors which are involved in improvement or deterioration.
So to sum up, plasma therapy is not a new treatment option, and so far it can only be used in the experimental stage to help aid severely ill COVID-19 patients. Doctors are basically trying to see if one COVID-19 recovered person's antibody-rich plasma can help aid another person who's going through COVID-19 right now. One of the benefits of this is that it is a tried and tested method, and versions of this have existed in the past to treat other epidemics like the Spanish flu of 1918 or other coronaviruses like the SARS in 2003 or MERS in 2012. Hopefully with new technology, chances are that it will be more effective. It is considered a low-risk treatment. The danger lies in the unknown. COVID-19 is a never-before-seen virus, and the pool to test on it is not that large. Officially, ICMR is saying that no experimental treatment should be carried out outside of clinical trials. But another critical care doctor we spoke to said that plasma therapy is no magic bullet. They point to a possibility of lung damage as well.
So here you require a DCGI and ICMR approval. Now, present state of regulatory approval is that both the DCGI and ICMR have made a protocol for treatment of plasma therapy, uploaded that protocol on their website, and they are now soliciting various healthcare partners to work with them as a part of multi-centric study.